actually going to be doing these things, as well as Dr. Nabila has added the CMOC component, the 3 major killers, which aren't in the PCPNC. So I'm very happy because even the WHO impact manual, we've been trying to dig it out. It's more than 10 years old now, and that desperately needs to be updated, especially with the PPH, the woman trial, etc. So thank you for providing us this opportunity to do this very significant work. Thank you.
Thank you, Dr. Sadia. I'll also request Dr. Khalid Shafi to please say a few words.
Thank you, the organizers, WHO and the Ministry of Health of this workshop. The neonatal mortality in Pakistan is 42 at the present, and it's not changed over the last 30 years, almost not changed. So this reflects the poor service delivery in our country, and also need the improvement and collaboration between the obstetrician and the pediatrician, because most of the children expire during the first week of their life. This workshop with the revised guideline and the subsequent implementation hopefully will improve and will bring us out of this apathetic situation. Thank you.
Thank you, Dr. Khalid. I would now request our worthy WR, Dr. Palitha Mahipala, for kindly sharing his remarks with the audience.
Assalamu alaikum and good afternoon. Thank you, Dr. Kutsia, for giving me the floor. The most respected and distinguished members of the head table, all learned galaxy of experts. I have never seen this kind of a crowd in my life, I must say genuinely. I have been participating as a special guest for many forums. I'm usually a invitee for the Gynae and Obs annual sessions, the College of Obstetrician and Gynecologists in Sri Lanka. I basically became a permanent invitee as either guest of honor or chief guest for last so many years for the College of Pediatricians annual sessions. So I have seen galaxies of experts from these two great disciplines, but today I am seeing all bring together. You have the professors of gynecology and obstetrics, you have professors of neonatal care, you have professors in midwifery and nursing, whatnot. So I'm really proud to be here. I'm honored to be here. I'm absolutely privileged to be here, and I'm extremely delighted to be here, standing before you in this wonderful occasion to say a few words. Today we are talking about two important categories of our population, the mothers and the neonates. How best we come together to do our best to safeguard their lives. That's the whole discussion, and you are engaged in a wonderful endeavor today, working together to revise comprehensively your guidelines and also formulate new guidelines. This is great. You need to contextualize. Even though WHO gives a guideline, you need to contextualize to your own country, and that's how you can go forward. I have been involved in maternal mortality reviews for maybe 20 years in my country. I was a director of a teaching hospital. I was the director of tertiary care institution which control all the teaching hospitals. And then I have become a Deputy Director General Public Health Services. So all these three levels I have directly involved in, not only maternal mortality review, near missus inquiries, and also many neonatal deaths meetings took place at the institutional level, district level, provincial level, and the national level. And I have been fortunate to become the Director General of Health Services in our country. And I make it that somehow all provincial and national maternal death review meetings I am there. That really make me enlightened about the issues, and also that helps to have good interventions to streamline the system. I always tell individual maternal death is extremely important. That put the things right in institutional level. So you need to take it not from the blame culture perspective, but as a learning exercise. I remember when we started going to institutions, when there's a maternal death happened, because maternal deaths are not so common as very correctly said. At that point of time, it was 32, and then we brought down to 28, and then of course we wanted to go for single digit, but we could not for last 10 years. It's stagnating. When you bring down the number of deaths, you need to have more quality interventions to bring it further down. Now initially the causes of maternal death were postpartum hemorrhage, postpartum sepsis and things like that. But today it is heart disease. It is medical reasons, not the gynecological reasons. I remember we had maternal deaths due to unsutured episiotomies. But today we don't see it. Because you have partograms implemented, you have so many things in place. But now bringing down to single digit is not easy. You need to have really high-tech care, really high-tech care. And neonatal mortality also same. And infant mortality is 6 per 1,000 live births in our country. So I remember once we were meeting together to set up targets. And some said we should go by the regional best. Thailand is equally good as Sri Lanka, and Maldives have made progress. And people were trying to see, okay, we will go for UK figures. I said no. We should go for the global best figures. Why are you talking about the regional best? You should go for the global best. If you have a dream to reach that, you will reach it. So Pakistan, I am telling, I think you should not look at any other figures. Compare with the global best. And recently I went through some figures. Japan has 2 for 100,000 births as maternal deaths. And some countries it is even lesser than that. So I saw 1 or 2 countries, I can't remember, 0 for years. So we should go for that. If you think, okay, we will reduce to 50 and then to 25, it will take long years. I'm sure that during our lifetime we won't be able to. But if you look at the global best and try to work hard on that, you will be somewhere there. So my message is that I think we should not look at to have incremental changes. You should go for the best and try to reach it. And when I look at Pakistan, I have been here for 2.5 years now. Your road network is superb. I can't match it any other country in the world. You have a superb road network. I have traveled to Balochistan by road. I have traveled to Karachi by road. Many times I have traveled to GB by road. And I get into the jeep in the morning 4 o'clock. 3 a.m. I am in Balochistan. 1,600 kilometers. Any country you can't go like that. So you have a wonderful road system. In Pakistan, if you look at the number of scientists produced by Pakistan, this is the 7th highest country producing number of the best scientists. I remember we organized a workshop for hepatitis C last year to commemorate the Global Hepatitis Day. It's chaired by His Excellency the President. And we had the clinical session later. And there were so many papers presented. When I heard, it's all from America and UK. They are Pakistanis. So you have so much of a huge think tank. When COVID started in Pakistan, I have set up a think tank to WHO office, and many international Pakistan experts participated, including Professor Gupta. So you have such a wonderful group, and within this room also you have so many experts. I think no other country has such a wonderful group of experts. So I am sure the comprehensive guidelines you formulated cannot be matched with any other country. I am sure you have done a wonderful, great job. But what is important is implementation. Now, looking at maternal deaths, when I came here, Kutsia, I think she's the first person I met who's responsible for maternal and newborn care in WHO. I asked, is there a maternal death review taking place in Pakistan? She said, no, only few areas, few institutions. I said, can't we make it mandatory in the country? You need to do that. All deaths during the pregnancy, we need to look at. Now all COVID deaths, we are reviewing. Why not maternal deaths? The moment you start to notify it, your system start to improve. People are cautious. Then they know that somebody is coming to look at this. Somebody is coming to look at this. I remember we started monitoring maternal deaths initially. There was so much of resistance from different colleges from the experts. They say, why you want to do that? Why do you want to have open discussions? Why you want to bring all the people to this? We said, no, we don't want who is involved with this. We just tell the incident and then go through it. We erase the name of the mother even. We don't take it. We don't take who has treated, who has been involved in treatment, but we look at the process. That's how we were able to bring down the maternal death. So I'm sure you are experts. I am not expert in gynecology or obstetrician. I am not expert in pediatrics, but I have a little bit of information and knowledge about public health. But public health interventions can change the world. So therefore, I am sure I can go on talking like this. Today morning, we started 9 o'clock with a special campaign to start with. Wear a mask to protect the nation. And people are talking so much about COVID. And Pakistan has made an outstanding, remarkable, comprehensive, unified response. You can't match it. I always telling this to international community. Pakistan with 227 million population. How many cases reported? If you go by 1 million population, 5,000 cases. Compared to all the other countries in Europe and developed countries, we are very much less. Number of deaths, 26,000 over 2 years. So it's a remarkable response. And wearing masks is a very simple intervention. We are doing so much well in vaccination. 61.43 million by yesterday